Health walks in previous election years have been an effective means of campaigning, but with the onset of COVID-19, Ghanaians have raised concerns about the propensity of the activity to cause an increase in COVID-19 cases. The situation is more worrying because of the low level of adherence to COVID-19 protocols at such gatherings. In order to address the issue, the Greater Accra NPP campaign team has resolved to halt all health walks in the region. Addressing the media, Greater Accra Regional Chairman of the NPP, Divine Agohom, urged all parliamentary candidates and constituency chairmen to adhere to the directives or be sanctioned.
The Greater Accra region has and continues to lead in the positive cases of COVID-19 virus so far, making the region the national hotspot for this pandemic. Despite enviable international recognition in our nation's sterling performance in the management of this worldwide pandemic, it appears our gains are being eroded by our own actions and inactions. In this regard, the Greater Accra Regional Campaign Team, in consultation with the Parliamentary Caucus of the region, has with immediate effect and commencing from today, Wednesday, November 11, 2020, suspended all forms of work in all the 34 constituencies in the region until further notice.
Meanwhile, the NPP's parliamentary candidate for Lejekuku and Deputy Minister of Health tells Citi News the move by the party must be commended.
Very excited that the NPP Greater Accra region has come out with such a decision, that it is true that our cases are on the increase, and at the same time political activity is also on the increase. In public health, that is a positive correlation. But when you study disease causation, they tell you that a positive correlation doesn't mean one is causing the other. So causation might be different from positive correlation. But what we are trying to achieve here is to get a situation where there will be no equivocation. So when we say equivocation, you don't want any form of confusion, because there are some who will say that, oh, once there is a positive correlation, both are going up, why not stop so that we can be convinced that nothing will happen? It is better to stop the works so that if the cases go up, at least others can look elsewhere for what is possibly causing this.